In the previous session, we saw how elevated levels of prolactin cause infertility and the best time for testing elevated prolactin levels during the menstrual cycle. Prolactin levels can be increased by many factors. Some are physiological, such as pregnancy and nipple stimulation. In contrast, some are pathological, such as tumor in pituitary gland. Chronic stress can also be a cause for increased prolactin levels leading to infertility. Today, we see in this video how chronic stress could increase prolactin levels and cause fertility. First point, chronic stress inhibits the production of the dopamine. In chronic stress, you feel consistently pressured or overwhelmed for a long period of time. Chronic psychosocial stress inhibits the production of the neurotransmitter dopamine. And, dopamine is an inhibitor for the production of prolactin. It acts through the pituitary dopamine type 2 receptors to limit the production of prolactin. This means that when dopamine production decreases, control over prolactin production is impaired, resulting in increased prolactin levels. Second point, stress increases the production of cortisol. Let us see how. Stress not only increases prolactin, but also adrenocorticotropic hormone. This adrenocorticotropic hormone is also secreted by pituitary gland, the same gland that secretes prolactin. Adrenocorticotropic hormone reaches the bloodstream and acts on the adrenal cortex to stimulate the production of corticosteroids, especially glucocorticoids such as cortisol. The cortisol generally suppresses the immune system. In contrast, prolactin actually activates the immune system. So, studies raise the hypothesis that increased prolactin secretion during stress acts to maintain immune homeostasis. In any case, increased cortisol production impairs fertility by causing irregularities in the menstrual cycle. Increased cortisol levels might affect the secretion of gonadotropin-releasing hormone, negatively affecting ovulation and reproductive functions. Further, when both cortisol and prolactin remain elevated in the body, the pre-ovulatory peak in luteinizing hormone and post-ovulatory estradiol level are suppressed. There are a few more points to note. Some studies show that childhood traumatic experiences, such as exposure to an absent, alcoholic, or violent father, increase the susceptibility of women to develop elevated prolactin levels later in life. Second, acute stress such as venipuncture also increases prolactin levels. One may experience a 2 to 3-fold rise in the prolactin level. However, it should revert to baseline within a few hours. There exists a strong connection between antipsychotic drugs and prolactin too. Most antipsychotic drugs can elevate prolactin levels. However, this effect varies among different drugs. The antipsychotic drugs increase prolactin by different mechanisms. For example, some drugs could inhibit or antagonize the D2 receptor of dopamine. Similarly, the prolactin levels could also be affected by their rate of dissociation from the D2 receptor. Moreover, the degree of increase of prolactin levels also depends on the dose of antipsychotics. Some antipsychotics, such as risperidone and paliperidone, might dramatically increase prolactin levels even at low doses. The injectable form of risperidone might cause greater increase than the oral form. In contrast, antipsychotic drugs such as aripiprazole, clozapine, quetiapine, and olanzapine might lead to only transient or less severe forms of hyperprolactinemia. Most importantly, do not change your medication without consulting your doctor. There are prolactin-sparing antipsychotics available if you are concerned about your current medication, and you should discuss this with your doctor. As the case with antipsychotics, antidepressant drugs could be associated with hyperprolactinemia. Evidence suggests that SSRIs such as sertraline, paroxetine, citalopram, and fluoxetine, tricyclic antidepressants such as amitriptyline and clomipramine, and monoamine oxidase inhibitors could also cause hyperprolactinemia. Prolactin levels usually drop shortly after discontinuation of the antipsychotics or antidepressants and typically return to normal within 3 weeks. There are prolactin-sparing antidepressants available if you are concerned with your current medication and you should discuss this with your doctor.